Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. This week we are talking about the classic hip shift in a squat. So what this is describing, for anyone who has lifted weights, they understand this is when you're back squatting, you may be even catching a clean, doing a front squat, body weight squats even, things like that. You notice that you might shift into one side or one hip a little bit more than the other, either on the descent, right down at that 90-degree bottom of the squat, or even when we are on our way back up. So maybe when we're coming out of the hole, out of the bottom of the squat, and we start to really put a lot of force back into the ground, we notice that when we do that, we immediately start to shift into one side as we do that. All these things are telling, they're important, and there is an assessment, or there's an important assessment that needs to happen in order to figure out what is exactly that is causing that shift to happen, what it's coming from, and then how we go about kind of addressing the different findings that could be causal to that weight shift in the squat. Now, these things will pop up in sports and competition as well, so it's important that we catch it in the weight room and that we understand what is going on, and then we can address the global issues that are causing it, which will have an effect on your performance, just in a slightly different way. It's not necessarily that if we prevent you from shifting as you go into a squat while you're playing a game, that's going to improve, but it's the things that we improve to improve the hip shift that will have these secondary effects on performance. So things like if there's a range of motion asymmetry that is causing that weight shift, if we address that range of motion asymmetry, we'll notice that weight shift goes away, but we also now are not playing and competing with that asymmetry in our range of motion, which will have other types of benefits for competition. Okay, so let's find out a little bit more about what's going on here.
So what is the hip shift in a squat? Well, the hip shift happens when we start to shift towards one side in the squat. Now here's an exaggerated version of a hip shift towards my left. And a lot of times that tends to happen when we get towards the hardest part of the squat, right around this parallel position. So what is happening when we're doing a hip shift is that we tend to have asymmetries in availability of range of motion here at the hips, the ankles, the orientation of the pelvis, and the ability for the different bones of the pelvis, that being the innominate and the sacrum, to move on top of each other, and low back mobility as well. So again, if we're doing a squat, the heavier we load it, typically we see more hip shifting occur. So if someone is susceptible to a hip shift, the heavier they go and the deeper they go into a squat, the more we might see either a subtle shift towards one side or a more exaggerated shift towards one side. Also, you'll notice that we might get this hip shift just at this 90-degree angle portion, or it might be only when we start to push back out of that hole, where we start to emphasize one side more than the other to get that work done. Again, all these things tend to show an asymmetry in range of motion. Maybe there's an injury history, but we also might have a little bit of a emphasis to produce power on one side more than the other. And again, that could come from an asymmetry and available internal rotation range of motion, or even a foot orientation issue, where we might have a flared foot and we might be lacking ability to pronate on one side and then put weight into that side. So if we're lacking that on our left side, we'll tend to shift into our right side when we really need to produce power and come up out of that hole. So what are some of the range of motions that we might look for? One would be hip internal rotation. How we test this is laying down. I want you to bring your thigh perfectly to 90 degrees here, and then we want to bring our foot towards the outside. So through here like this. Now we want to get as much range of motion here as we can without letting our hip or thigh start coming in towards the midline. Now we'd expect at least 30 degrees, hopefully 45 degrees of internal rotation. And if we try that same thing on the opposite side, what we want to do is we want to see symmetry between both sides. If you notice one side is more difficult, you're not getting as much range, then we know there's an asymmetry there, and that might lead towards a hip shift towards the side with more range of motion. We also want to test external rotation. Same thing here, but now our foot's going to come towards the midline, and our thigh is going to externally rotate. Again, test this on both sides and see if there is an asymmetry from one side to the other. this will be the side that we are more comfortable shifting away from or pushing towards the other side. We'd also like to test ankle dorsiflexion. What we're going to do here is measure a distance from a wall to our foot, hopefully 4 or 5 inches. What we do from here is keeping our hip perfectly straight. Is we're just going to place our knee towards that wall without letting this heel come off the ground. Again, we're going to measure this on both sides and see if there's any difference or a big asymmetry or major restrictions on either side. So we're testing and measuring about 4 to 5 inches from the wall. Pick 4 to start. Keep your foot fully flat on the ground. Don't let your hips shift from side to side. Keep them perfectly straight. And then try to bring that knee towards that wall without letting that heel come off the ground. Another very important idea here, or concept, is the anterior tilt. So something we need to be aware of is our orientation here at the pelvis. So you can see here, if my belt line is tilted down and pointing downward like this pelvis is in a anteriorly tilted position, and my low back is probably going to be in a big extended position here. What we want is for that belt line to come back neutral like this, creating a neutral pelvis. The orientation of the pelvis, if it's neutral, it allows us to sit straight down into a squat. So again, if I have access to a neutral pelvis and I create a neutral pelvis, I can squat straight down. If I'm stuck in an anterior tilt, that pelvis is tilted forward, and I'm still going to squat straight down, but in this case, down is going to be slightly down and back. So now the squat, the hips have to come backwards. Now from here, I have to counterbalance. So if my weight starts to shift backwards in the squat, I now have to hinge more up top to keep my center of mass over the midfoot. Again, so that creates a compensation where we're starting to hinge more in the squat. Now that's the sagittal plane. So if I have an anterior orientation that's more pronounced on one side of the pelvis, then we can start getting asymmetries, which start to show up in that frontal plane, which again is that side-to-side hip shift. So if I have one side of the pelvis that's slightly more flexed and one that's a little bit more extended, and I'm a little bit more anteriorly tilted on that one side, we can create a hip shift to one side compared to the other, right? And there's some more tests that we can do to see the orientation of the pelvis on one side relative to the other, and that requires more hands-on work. But again, that adds to the story. So what I really recommend is coming in and getting evaluated where we can do all these tests, put the story together, find out where there's some orientation issues at the pelvis, and then we come up with a plan to start working on some of that range of motion while retesting and bringing you back into squats to get that squat where we don't necessarily have to hip shift anymore, whether it's due to a range of motion issue or a power production issue or a past injury that's trying to keep you off that side.
So that video there helped demonstrate with some visuals what is happening, what we're talking about with a weight shift. A few examples of some testing that we would do, like that hip internal rotation, external rotation test. We'd also want to see where the maybe a potential global flexion of that lumbar spine is happening, where we call that kind of a butt wink, where that pelvis kind of dumps underneath, and we get that lumbar flexion, right? And some other things that we just want to understand regarding some range of motion things. If we have any golfer or any athlete or weightlifter, any active adult that's coming in, we'll take a much deeper, closer look at a lot of different things that we can't quite include in that video to figure out exactly what's going on. But again, if we just want to understand some of the broader things that are included in the weight shift, that video demonstrates a lot of the good broad tests that we would do. Now, we need to understand the importance of the frontal plane versus sagittal plane compensation. So we talked a little bit about when you can't necessarily get down deep into a squat without your trunk coming way forward or flexing a whole bunch at your hips, right? And that's just a compensation for bringing your center of mass back over your midfoot, because you run out of range of motion somewhere, requiring you to shoot your hips now instead of straight down. They have to go backwards. And when we go backwards, to stop us from falling backwards, we have to bring weight more forward over our front foot, back into our midfoot. In the frontal plane, which is a side-to-side plane, so we look at it when we're looking at you from face on, is we see that lateral or side-to-side deviation. That's what we're talking about today, is that hip shift. When we are lacking range of motion in one hip or the other, especially internal rotation, we might deviate towards that other side hip, which might have more access to internal rotation. So when we are especially towards that 90-degree mark, if that's where we're shifting, then it's probably an internal rotation issue where we're shifting into the side with a little bit better internal rotation, because that's what we need at that moment. Not to mention, especially when we see the hip shift as we put force back into that ground to really start coming out of the hole, if that's when the weight shift is happening, when we're really starting to push down to come back up, then again, they were probably shifting towards the side with better access to internal rotation because of how important internal rotation is to creating force, right? Internal rotation, you can think of it as really just a down force. The things that are happening to create the internal rotation is a power strength producing motion. Okay, and that comes all the way down even to the foot. I had mentioned earlier we'd want to do a whole lot of other testing to really see what's going on. A lot of that would be happening at the foot. What's happening there at the foot? Are we able to pronate at that foot? Do we have tibial external or internal rotation happening? Is there tibial torsion present where that tibia is a little bit, you could say, corkscrewed or rotated in itself? Is there knee bowing, or is there some valgus where the knee's coming in towards the midline? What are all these positions that are influencing our ability to put internal rotation and force back down into that ground? So what we need to know is all of these things, and then we can kind of come up with a plan. But if we're just going to kind of go off of our weight shift where we're shifting into one side and that's all the data we're going to collect, there are some things that we can still do and try to get a positive result here, where we learn to start evening out that squat, where we're getting more internal rotation onto the opposite side, and we're getting more external rotation onto the side that we're shifting into, right? So that we can start to even it out, pull ourselves back onto the opposite side that we were shifting away from in the first place. All right, so we'll show you a few exercises and progressions that you can use going forward. And I outlined them as, and the companion article that goes with this will help you out if you go check that out on the website. It's labeled hip shifting in a squat, ? That again will have links to all these exercises as well as descriptions of which side to do it on, but I'll try to describe that as we move along. So the first exercises here are going to be exercises and drills that push us out of the side that we're shifted into. All right, so if I'm shifting my weight towards the right side as I'm coming out of the hole, then these exercises I want to do to help push me back onto the left side. Okay, this first drill, the supine 90-90 breathing with posterior tilt. This is a general, just kind of generic exercise that will help get us out of that anterior tilt. So we don't do this on one side or the other. We're doing both sides at once. I'd mentioned a lot, especially in the article that goes with this, about anterior tilt as an issue causing some of our weight shifting issues. So if you have a one side of the pelvis that's a little bit more anterior tilted or anteriorly oriented, then we might have an issue shifting weight or getting into internal rotation on that side, and vice versa, right? So the anterior or posterior orientation of the pelvis, especially from one side compared to the other, so an asymmetry in there, will result in frontal plane or that side-to-side differences where we might lack range of motion or be more biased to create force on one side relative to the other. So this first drill here, what we're doing is working on just bringing the pelvis back posteriorly slightly here, and this works on both sides just to bring us back into what would be more of a neutral state. When the pelvis is neutral, those hips become more centrated and back in their ability to create range of motion in any direction improves. Okay, so with this drill, we have our heels, our foot flat on the wall here, both of them. We're digging our heels down towards the ground to create some hamstring activity, just slight. What that does is that should be enough to peel your tailbone off the ground just slightly. So we're just getting a little posterior tilt in that as we do it. Let's see it from the side view. Is that as I dig my heels down into the ground, you see my knees just lift up slightly. So we're just getting a little bit of separation here from my lower tailbone. And you should notice that the pelvis and the bony ridge of the pelvis and the low back stay flat on the ground. It's just right here that's coming off the ground there. Okay, and so otherwise we're getting into that position. We're just peeling our tailbone off the ground, which is putting our pelvis in a little bit of a posterior tilt, and then we're just owning that position there. Okay, the foam roller is just here. It's just creating me a little tactile cue to keep my knees kind of in line with each other and in line with the hips. So I'm just putting enough pressure into that foam roller to keep it from falling. Really, that's about it. So we're not jamming our knees into that foam roller. And then from here, the breath is really important. We're going to use the same breath for every single drill and exercise we do. What it's going to be is an exhale through the mouth, and you want to feel like you're fogging a mirror or a glass. So just let that air kind of fall out of your mouth and get every last bit of air out, really pushing all the air out. And you should feel your obliques start to work to push that air out, right? So you should feel the side abs working towards the very end to push that air out. And what that will do is it'll bring your ribs back in internal rotation, and it'll close your ribs down on top of each other right through here. As I'm kind of demonstrating there, your ribs start to fall in towards each other towards the very end of that exhale. What you do next is you hold that tension, like a 2 out of 10, right? So if you were at a 10 before with the obliques, when you go to inhale, you just hold like a 2 out of that 10. It's just a little bit of tension in those side abs. Make sure that the six-pack abs there aren't working too hard at all, and the neck musculature should not be working at all. When you go to inhale, you inhale through your nose, but it should be silent. So slow and silent. This helps keep us from using our chest and our neck musculature to inhale. And we should feel that as we're kind of resisting that big rib flare here, that with that ab tension that we've maintained, that we're getting full expansion through here. Our pelvis is staying in that neutral tilt, and that's how we start to bring that pelvis back from that anterior oriented position there. Okay, this next drill is the sideline glute max drill. I'm going to let the full video play here. Remember, when we're doing this, in your case, you'll be doing this on laying on the side that you are normally not shifted into, right? So if you're shifting into your right side, we want to make sure that we're laying on our left side here and that we're using our right side for the active part of this. This is teaching us to shift out of the side that we're normally shifting into. So again, if we're normally shifting into our right side, I want to make sure we're laying on our left side and working the top right side for this exercise. If we're normally shifting into our left side, I want to make sure we're laying on our right side and we're actively working on our top side here, the left side, to push back in towards the right side.
Okay, this is our sideline scissor glute raises. So a lot going on there. Let me show you what it's all about. We're gonna be on the floor with our feet flat on a wall, our hips at 90 degrees, and my knees at 90 degrees. Okay, from here I want my upper body stacked so my ears in line with my shoulder is in line with my hip. Okay, once we're in the starting position with our feet stacked and flat on the wall there, I want you to pull this this top side hip down towards the wall. So we should create a little space right in our lower rib cage between us and the ground. If that space isn't there and this hip is hiked up towards us, we don't want that, right? So kind of block through there. I create the space by pushing my top hip down, and that little space opens up. We maintain that throughout the exercise here. Now, next we want to push our top femur forward as much as we can through here without using my low back and just rounding to get there, right? So these all stay stacked. I have my top hip pulled towards the wall, and then I'm pushing my femur using my hip to do so out over top of my bottom knee, all the while my feet stay in contact with the wall. Now the foot contact should be the inside edge of that top foot is where we're considering most of our weight in contact, right? So the inside edge of the heel, the inside edge of the foot, and the inside edge of the ball of the big toe. But we don't want to lose that outside edge either, right? Just we want a majority of it focused through there. So hip down, foot inside edge as I pull that or push that femur forward. And then from here, we raise that knee as high as we can without losing that inside edge of the foot. Let it go back down. I'm maintaining this pressure, this push of my knee forward. I maintain that, I maintain it. I maintain it as I bring that forward. I never lose that inside edge of the foot. I let it back down. I'm still pushing forward. And now forward and up. Still forward, now forward and up. I'm still pushing through that inside edge of my foot. This hip is still pushed down towards the wall. Okay, you should feel that outside edge in the back of the glute really starting to work hard through there. This is great at creating space in that hip, as well as using the muscles, especially the glute, in that position. All right, so go ahead, give it a shot.
Now we are going to kind of shift into exercises that we're going to be focusing on bringing us into the side that we normally shift away from so that we're comfortable with creating that internal rotation and all the range of motion as well as the motor control to pull us into that side that we're normally shifting away from. So the first one is the standing posterior hip capsule drill with a little bit of adduction. I'm going to let that video play out. Again, we're going to make sure that the back leg on this side, the one that we're working and kind of stretching, the back side leg that we're going to shift into is the leg that we're normally shifting away from. So if I'm shifting into my right side, I want to make sure that in this case, I have my left side back on the raised surface here as we do this drill.
Okay, for this posterior hip capsule stretch, what we need is an elevated surface, anything from 3 to 5 inches tall. You can use a weight plate, anything like that that you can place your back foot onto. Okay, if I'm working on my left side hip, what I'm going to do here, place my full foot onto this elevated surface. We're going to keep full foot contact on this front side foot as well. So I don't want you to let your inside edge of your toes or your heel come off the ground on this front foot, but we're going to start shifting our weight onto this back side foot. We want to think about keeping our weight mostly on the heel and the middle part of this backside foot. Okay, so as we start from here, I'm going to shift my weight back onto this backside foot. And from here, we can increase the stretch. Again, I still have full foot contact with this right foot, but most of my weight is in the heel and midfoot of this left side. From here, I can start to sink into that a little bit, and then I can even reach towards my left side knee to really increase that stretch and opening of that left hip capsule. Now from here, we can begin integrating some other things where I want you to actually start thinking about bringing this left knee towards your right side knee just by activating your adductors here on the left side. So we might not get too much motion here from this, but if you actively just try to do that, we activate those muscles, we'll start to get some adductors into that as well. So again, we shift our weight in this backside foot, keeping full foot contact in both feet. And then from here, we start to sit down into it a little bit, just feeling that stretch, make more of a hinge motion here. And then we reach towards that left side knee. And then we start actively trying to bring our left side knee towards our midline. From here, breath in through the nose, out through the mouth. I want you to really overemphasize that. Very slow breath out through the mouth. We want to get every last bit of air out. When you do that, you should feel your side abs and your abs start to work to push that air out. I want you to maintain some of that tension, especially here in the side abs on that very last end of that exhale. Maintain some of that tension as you breathe back in through your nose. What that does is it starts to bring the rib cage down and in, and I want you to maintain that rib cage position as you breathe back in through your nose. So we really have to use our diaphragm to expand through that rib cage instead of just orienting and just flaring the ribs up, right? So we start to teach that control over the rib cage as well. All right, go ahead, give that a shot.
Okay, the second exercise for teaching us to come back and pull ourselves into the side that we're normally shifting away from is the side lying 90-90 hip rolls. In this case, I want the side that we are normally shifting into to be on the top and the side that we want to learn to shift into on the bottom. So we're going to be laying on our side. If I'm always shifting into the right side, I'm going to make sure that I'm laying on my left side. So in this case, we are rolling on top of the side that we want to learn to start to shift into again, okay? So check out the companion article as well for kind of reps and ideas for that. And it also demonstrates and tells you which side to do in that companion article as well. So I'll let that side lying 90-90 hip roll video play out here.
Okay, for our scissor glide movement, what we want to do is get on our side. We're going to be in that 90-90-90 position again, where our ankles are at 90 degrees, our hips are at 90 degrees, and then our knees are at 90 degrees and our hips are at 90. We want to think hips in line with our shoulders, in line with our ears, where we're not kind of crunched forward like this. We want to keep this in a straight line where our spine is as long as we can get it. We also want to think about creating a little bit of a tuck in our pelvis where we're coming out of this position and tucking it underneath us a little bit into a slight tuck. And then again, we're going to have our feet glued to the wall, especially our heels. Really important to keep that in mind. Firm contact with the wall. From here, we want to push our knee forward. And then we want to use our hip to pull that knee back. Again, our feet stayed glued to the wall. We can use this hand even as a little bit of support here to make sure that our entire upper body isn't rolling with it, including our lower back, and our lower back coming back like this. We want to avoid all that. Post up here, long spine, everything in line, keeping our feet glued to the wall. Push that knee forward using your hip slightly, and then pull that knee using your hip again back. Never losing any contact with the wall through our feet. Give that a shot.
Okay, last for kind of integrating everything all together, we're doing a lateral kickstand hinge. And it's more of a hingey motion, but there's some squat components to it. But overall, we are learning to, again, push ourselves while we're standing up, push ourselves out of the side that we're normally shifting into, while we are accepting weight and load and creating force into the side that we're normally shifting away from, right? So we're going to do this. We're going to hinge towards the side that is opposite our normal weight shift. So we're going to hinge towards the side that we normally shift away from, and then we're going to do sets and reps from here like that.
Okay, here we're doing a version of the kickstand hinge, but we're doing it from a position of this lateral glide, okay? So for here, we're going to start with our feet a little bit wide like we're doing a Cossack squat like this, but we're not going to go that far down, so we don't need to be that wide. Now from here, we're going to shift our weight into this leg. We want almost all the weight in this leg, right? So if I were to lift this leg off the ground, I wouldn't have to lean over here to keep me from falling back this way. Okay, so all the weight through this leg here. Now from here, we're just going to continue that hinge, now straight forward and backwards as opposed to left and right. So from here, we're hinging, we're staying tall from my head to my sacrum, trying to be as long as you can in the spine as we push this hip backwards. We get a good stretch through that glute there. Then I want you to use that stretch to start to push that hip back forward. Okay? We can try the same thing on the opposite side. Now from here, we're going to push this hip. Think about pushing the front of your hip straight backwards as we're staying as tall as we can in our spine. No crunching or rounding like that. Staying tall. Trying to keep everything square to the wall in front of you. Hinging down and using that stretch to come right back up out of that hinge. Go ahead, give that a shot.
All right, so we got some good exercises, progressions here to work on. I'd say give this a month's worth of working in maybe the first set of drills in one day, the second set of drills the next day, and then alternating those for a week, maybe 2 to 4 times a week, and then start mixing in the last set with the lateral kickstand hinge to integrate those here and there, maybe once or twice a week. All these can be part of your warm-ups or cool-downs to help teach the body how to get in these positions, work on the motor control and the range of motion as we do them. Right, so this is kind of a broad view example progressions that we can use to help address weight shifting in the squat, as well as any other movement, heavy cleans, full clean snatches, hang snatches, anything like that. It's also going to help our ability to do lunges or anything like that where we need access to range of motion. Even if our compensations aren't as obvious in some of these other motions, it'll certainly still help us out there. And performance will improve because now we have better access to range of motion, and then we are starting to control and own that range of motion and motor control as we work through these drills that will show up on the court or the ice or in the CrossFit gym or on the golf course. Okay, and to learn some more about some of these other concepts we talked about, like what is internal rotation, I have articles for these. One article on the website in the blog section is labeled what is internal rotation. Another one is what is external rotation. So I talk about some of these concepts here, talk a little bit about how internal rotation is a down force. It is a force producing motion. External rotation is kind of a space creating motion, things like that. I'll link those in the description as well for the podcast. But again, check out those articles. Read the companion article for this one. I'll have that posted down there as well. And then feel free to reach out, email, call. You can even text the number or go to the website and create a reach out via the email or the box there to type in the text with any questions you want or progressions for these questions on these exercises, or if you're interested in getting checked out and doing movement evaluation if you have any pain or just want to improve your performance, feel free to reach out. I'd be happy to help out. Thanks. Bye.